Run VT, we are live, and I know I'm a bit late. I've been doing a bit of, as you can see, the angle, different setup, because I've been trying to get to show you a photo. I'm sure I worked out how to show photos a few weeks ago and failed just now. So I'm using my remote webcam, and I'm going to turn it to show the photo, because I thought I'm sure there was a way I could get it on the screen, but I've just spent quite some time trying to work it out and failed. So yeah, hi. Tuesday night, Facebook Live. Jonathan Staiano here. If you've got any questions, please ask me, and I will do my best to answer them. Apologies for being late tonight. If you have anything to say, then please do. This is weird now because the camera's over there, and comment and share. So feel free to comment and share if you've got anything to say. And if you're interested in podcast type things, there is a podcast on iTunes of this broadcast, and the photo won't go down well on that, will it? But I'll describe it. So if it's on the podcast, I will describe the photo. It's mainly an audio thing, this, let's face it. And there is also, we put this on YouTube, we chunk it up for the specific questions, and also put the whole lot on YouTube, and as well as other stuff on YouTube. So you can welcome to look at that. Olivia's here. Hello, nice to see you here, Olivia. Nice to see you. And let's get on and do what we've got to do. So I'm going to look over here to do the things. So, does that question come up? Neck lifts. Neck lifts. Please explain recovery time. Where are the scars? Length of time off work. Does it make your face look old in comparison? Full disclosure, I don't do this sort of thing, and I've always said I'm very happy to answer questions from people who've had surgery in different places by different surgeons, and about things that are maybe not necessarily in my immediate field. So plastic surgery obviously is the heading, but within plastic surgery I specialize in breast and body. So this is a bit outside of my my expertise. So I would say take what I don't take what I say as gospel. In fact, don't take what I say as gospel for anything, because there's opinions and all sorts of things. So this is just my view of neck lifts and scarring and what have you, and does it make your face look old and things. Obviously a lot of cosmetic plastic surgery is lift related, is lifting, tightening, anti-aging, because things droop and sag, and lifting means usually making scars, because it usually means cutting skin out to tighten that skin, and that's how you get the lift. And whenever we make scars, we aim to hide them in places where you can't see them, which is why a lot of people say plastic surgeons, oh, they're very good, they don't leave scars. Well, we're just very good at finding shadows and natural concavities where we can hide shadows, hide scars. So and again, this is my view in terms of the neck, of taking skin or tightening the skin of a neck. The best way to do that whilst hiding the scar is a facelift, basically, a full facelift. So a full facelift is a scar which goes in front of your ear, it then goes up the back of your ear, and then it goes up into your hairline, and the skin is pulled, both of your face and your neck. So that is where I would, from my experience of face and neck lifting, that's where the neck lift would come. Now you can sometimes, I think it's last week or week before, someone talked about double chin and liposuction. You can do liposuction, which will help to take away a double chin, and that skin may recoil. But if the problem is double chin, that's different. But if the problem is too much skin, and it's a neck lift that you really need, the best way to take that skin out is to make the vector pull right up into the ears, and that will be with a face and a neck lift. Now, sometimes you can make a nice hidden scar underneath the chin here. That's a nice place to hide the scar if you need to access the neck. But that would normally be, sometimes people have what's called platysmal bands, lines that go down the neck, which are some of the muscle within the skin called the platysma. And that can be overactive, and so that can be divided by making an incision under here. But I don't think you can get a significant lift of the neck. You can certainly divide those muscular bands, but you're not going to get a significant lift of the neck with that incision. So really, we need Khurram here, to be honest with you. And goodness knows, I've tried to get him on side several times. But we need Khurram here, because Khurram will probably be able to answer this a lot better than I can. In fact, you know what? I should have asked him. When did I see him? I saw him yesterday or today. Anyway, yesterday I think it was. Anyway, so yeah. So in my experience, the best way to really tighten the neck is with a full facelift, and that answers your question about does it make your face look old in comparison. But it's a good point, because you have to do things in balance, because in terms of a facelift really tightens and rejuvenates the lower face. You might have to look at the other proportions and keep things in balance, not just in terms of the aging, but in terms of the geometry of your face. So sometimes people feel that their nose is not right, but it might be the chin that's not right, or doing the face and the neck, and leaving the eyes and the mid face, which can be done with a lower blepharoplasty. You get a mid facelift, which is here at the cheeks. That's not really addressed with a standard facelift. A standard facelift really does this bit here, whereas sort of higher up here is usually through a lower blepharoplasty incision. You can tighten the cheeks, and obviously upper blepharoplasty for the eyes, eyelids, and brow lift. So these things all have to be taken in consideration, and just doing one thing is it can make things look out of balance. But a neck lift on its own, I'm not aware of that being a thing. So in terms of recovery time, where are the scars? So the scars are underneath there for a facelift. Recovery time, you'd be battered and bruised for a couple of weeks, and you'd probably want at least 2 weeks off work. Maybe 3, depending on if you're sort of client facing, because you look quite bruised and quite swollen and quite strange to start with. So if you're client facing, you may want 4 to 6 weeks off. But if you're not and you work in an office, particularly if you're working in your own office, you'll probably after a couple of weeks you'll be able to get back into things. But all these things are probably best spoken to with a guy that does it, or with your surgeon type thing. What keeps on coming up? Here we go. Olivia's got a question. Look at that, and that's what we want. Khan, how did you nearly miss me, Khan? I was late. A bit late tonight, Khan. Olivia's thought of a question, which is fantastic. We fully support that. With the breast lift, can you not take some fat from somewhere else and put it in breasts if you can find any? Yes, you can. So, oh, sorry, I've got the wrong question up. So, yes, you can, Olivia. You can take breast from somewhere else, and I think that this, it's been bubbling around the fat grafting. Maybe it's going to be doing more of it, and certainly it's something that I have done, which is a breast lift and fat graft. The problem with the breast lift is that to get sustained fullness in the upper part of the breast, so you can do a breast lift and you can fat graft into the upper part of the breast to enhance the volume. In my experience, which isn't huge, got to be honest, it doesn't give a huge benefit in terms of the shape, and I think the shape settles whatever because of gravity, because fat is your natural tissues, whether it's fat that's already there in the breast or whether it's fat that you're grafting in. So breast lift and fat graft is not great for getting the shape to be sustained fullness in the upper pole. I guess the only place a fat graft would be useful is if you wanted extra volume, and then we get it back into the debate of whether we do fat grafting for breast augmentation, because the volumes are much less than you could do for breast implants, and so and the procedure is very expensive. But yeah, certainly for volume, it would give extra volume, but it would increase the price. So whether it's worth it or not, that's what it's all about. It's the value for money that you're going to get, and that's a bit suspect whether it's value for money. I suppose only you can answer that question, but you have to have a realistic idea of what sort of volume you can get, and it's often not a huge volume you can get with fat grafting. But yes, it's something you can do, breast lift and fat grafting, but again, it's not particularly common procedure for the reasons that it is expensive and the increase in volume is often subtle. Olivia's trick. Oh, Olivia's on fire tonight. Already had blepharoplasty, lower. May skip neck lift at the minute. Yeah, computer's going into battery mode. That's good. Yeah. Well, I guess it will be facelift. Olivia would be the thing. The next thing. If you were going to do something else. Mons Lifts. Right, now we've had people say, still on audio, am I still there? Is the audio all right? Because I usually have a mic, but I hope the audio is all right. What is the Mons? So, because I've had that before, what is the Mons? So the Mons is the sort of bit in around the pubic bone, around where the pubic hair is. So if you think of a pelvis, the skeleton of a pelvis, the where it joins at the two bits of the pelvis that join at the front is the pubis, the symphysis pubis, and it's the and you can feel the pubic bone there. So that's and sometimes you can have fullness there. Usually with people who've had significant weight loss, you can have fullness in the Mons area, and it's often visible or becomes a problem when you've had a tummy tuck, because when you haven't had if you've lost a lot of weight, you've got a very prominent Mons, and if you have got a prominent Mons, it's usually people who've lost a lot of weight. It is sort of hidden by the abdominal apron. So if you haven't had a tummy tuck, people often don't know it's there. So it's something that you often notice when you've had a tummy tuck. You think, what's going on there? What you put there? You haven't put anything there. It was already there, but it's obviously more apparent because the abdominal apron gone, and all of a sudden there's this bulge in that Mons area. You think, what's going on? So what was the question? Mons lift, does it involve liposuction, recovery time? Do you need to be catheterized after surgery? How much pain is there? So it can involve liposuction and it does involve liposuction, and really it comes to when you're doing the Mons lift. So we can do stuff to the Mons when we're doing a tummy tuck to try and reduce the fullness there and decrease the need of you needing something else done. But if you do have a significant ptosis or sort of droop or fullness to the Mons, then you might need something done as a second stage, because it's hard to address the Mons too aggressively at the time of a tummy tuck. Because otherwise the scar will drift up. If you undermine too much inferiorly, too much south, your scar won't be anchored low and it can drift up. If you're going to do it at the time of a tummy tuck, then liposuction will be perfectly reasonable, to do some liposuction to the Mons area to try and reduce some of the heaviness, some of the fullness there. And that if it's only a mild bit of fullness there, the skin might well recoil, and that will be all that's needed. And as I say, that could safely be done at the time of a tummy tuck. But if there's a lot there, then you might need to take out a wedge to tighten the skin and take out some of the fullness there, which could be plus or minus combined with liposuction. But if there's a lot of skin there, the age-old problem with liposuction, with it not removing skin, so you can be left with baggy skin. So you might want to make a cut to remove that, but that would usually be done some months after tummy tuck. Do you need to be catheterized after surgery? Catheterized after surgery, main thing, catheterized after surgery, there's two reasons or two, I guess, indications for catheterizing someone after surgery. So catheter, do people know what a catheter is? Catheter is a tube goes into your bladder, so you don't have to go for a wee. And so the two reasons are, if you've done some surgery to that area and there's trauma to the area and you don't want sort of a passage of wee, especially if you've done any surgery in that area, and as plastic surgeons, that, believe it or not, is a subspecialty of plastic surgery, genitourinary plastic surgery, the people who have abnormal congenital abnormalities in that area. So we are sometimes doing surgery to refashion the urethra and what have you. And in those circumstances, you don't want urine constantly flowing over your sutures, so you might catheterize someone so that the wounds can heal. So that'd be one reason to do a catheter. Clearly not in these circumstances like a Mons lift and a tummy tuck and stuff. So the other reason to do a catheter is if someone's having surgery for a long time, because obviously they're not going to the loo while they're in surgery. So if you're having surgery for a very long time, if it's a very long time, then obviously you have to catheterize them because you need the bladder will be really full. But also we can monitor urine output to if someone's going to be ill. Again, not really for cosmetic surgery, but if you're having a big op and someone's worried, you're worried that you've got your fluid balance, fluid going in and out. It's a much more accurate way of measuring the fluid balance. But mainly for plastic surgery, if you're catheterized, it's for comfort. So if you're having a big op, like for instance a tummy tuck or something, I tend not to catheterize people, to be honest with you. But if you're having a big op, you've had a lot of fluid during the operation, and you wake up and you need to go to the loo, it can be a bit difficult because you're in a funny position and you can't really get up and walk. You often have drains and tubes and drips and things. So for comfort, it might be that you be catheterized. I don't routinely do it. If we're doing a big op, then what we might do at the end of the operation is do what's called in-out catheter, which means we'll empty your bladder with a catheter, but not leave the catheter in, not leave the tube in, just so you don't have the discomfort when you wake up and you're dying for the loo. And then by the time you need the loo, you'll be a bit more mobile. And if you can't get up and go to the loo, you'll have a bedpan. But that's my regime for catheters. And I don't really catheterize anyone. Maybe if they're having a massive operation like a 360 lift with a breast reduction or something, some big op, maybe we think this is going to be a big op, let's do the catheter. But yeah, it's usually an in-out at the end of the operation or none at all. And for a Mons lift on its own, you wouldn't need to be catheterized. And there's not a huge amount of pain in the Mons lift because it's all soft tissues, there's no muscles involved, so it's obviously tight, just like any sort of body contouring, but nothing too drastic. So, what's going on? Here we go. What causes the Mons? Does it have fat that just doesn't go from there? Not worded very well. I was catheterized after gastric sleeve, Grim. So the Mons is there in everybody. Everybody has a fullness there. If you look at a body, the abdomen, the abdomen comes down, and then there's the Mons. Over the pubic bone. The Mons is a natural anatomical area on everybody. Everybody has a Mons, so it has a bit of fullness there. What you're saying, maybe Olivia, is what causes a problem with the Mons if it's too big, and it's the same as what causes a tummy tuck. Usually, putting on and losing weight, having a lot of weight, stretching the skin. Stretching force goes and you're left with redundant skin and baggy skin. It might be, if you are still overweight, there might be fat there as well, or if you've lost the weight, it might be just the skin, exactly the same as a tummy. So there's often fat there as well, but it's mainly skin that's the problem, skin and fat. And as I say, it's exactly the same for the Mons. So it's usually weight loss that's caused it. So scar vision, we've got a couple of scar vision questions. One is chat with a scar here. He hasn't got back to me about showing his photos. He's emailed, so I won't show his photos. So he's it's a scar here, and it's a slightly stretched scar. It's obviously a traumatic scar, not surgically made. So also about scar vision. So the thing about scar vision, people often say, plastic surgeons, they're brilliant, they don't leave scars. Now, as I say about the facelift, we can choose where we put scars, and just see if he's replied about that. We can choose where we put scars, and we will hide them. If you've got a traumatic scar, if you hit your head on something, no, right, so answer that one, then you've got to have the scar where it is. And so if we're going to do a scar revision, we're going to give you the scar in the same place. So the question is, what is the problem with the scar as to whether we can make anything better? This chap is slightly wide, the scar. It may not have been sutured, or it may have been sutured and come apart. So it's slightly wide, but there's a lot of good things about it. It's mature, it's pale, it's skin colored. It's actually hard to see. It's only in certain lights. Slight indentation to it, but nothing drastic. So I would say, first of all, there's a lot of good things about it. But if the scar is slightly wide, slightly stretched, we can revise that and then bring it together and make it less stretched. It'll still be a scar there, so you've got to be very realistic about what the option, what the outcome is going to be as to whether it's worth going down that route, because there'll still be a scar there, and the actual scar itself will be red and obvious for the first few months, and probably takes about a year for it to really properly settle. So you will go a bit backwards before you go forwards if you have a scar revision and that sort of thing, but it might be something that's worth it if it really bothers you. But it's just about being aware that we can't get rid of scars, we can only change them from sort of one thing to another thing. So the other one we've got, which is now the whole setup, which is the reason I'm late, so I hope you're excited about this. I hope you're as excited as I am. What's going on here? Oh, Anna's in. Buonasera, dottore, quando venite a Napoli? I don't know, Anna. I don't know when I'll be coming to Naples. Yeah. But I'll be sure to let you. I'm sure to let you know, Anna. I think you're taking my dad. My dad's getting on a bit now. I don't know how he'd cope actually, but I think you're taking him to Italy. But his passport's expired. But anyway, enough of my problems. But yeah, thank you. Nice to see you, Anna. So the scar. Here we go. Right. Professional camera work. Swoop. I think you'll agree that wasn't really worth it, was it? I think we can all agree that wasn't really worth me taking half an hour to do that. I thought I could get it up on the screen, but I'm basically holding the webcam to another screen to show you. So, well, sorry about that. I'm sure I did it on the screen once. Anyway, that's so. I don't know if you can see that. There's a belly button there, and then there's a sort of dent below the belly. I think it's below. I think I've got it the right way around. That's the nice thing. I think it's below the belly button. So obviously there's a sort of dented in scar. Again, the actual scar itself is hard to see, not least because it's in a shadow. But that is so as I say, the last one was a stretched scar. This is a dented scar. So if the scar is dented in, it's puckered in, and it's often the way on the abdomen. It's often appendix. This isn't an appendix. I'm not sure what this is. Oh, here we go. I've got some. Hi, I have an abdominal scar that I have had for approximately 45 years. Wow. And would like to know if it is something that can be changed at all, please. I'm not sure if it's scar tissue underneath it, but it bulges and makes me very self-conscious and unhappy. So, wow, 45-year-old scar that. So that's obviously something as a child. And it's often the way in the abdomen that you get scars like this, dented in scars, because there's quite a lot of fat between the skin and the anterior abdominal wall. And this sort of thing is not uncommon with an appendix. I've got a photo on my website of an appendix scar that I revised, which is similar to this, very dented in. And the scar tissue goes all the way from the skin down to the abdominal wall, and that makes it puckered in. Now, you might think just cut it out and stitch it up. But if we just cut it out and stitch it up, we give you a scar just the same as what you've got, and it'll probably look all right to start off with because you cut all the scar tissue and look all right. But more scar tissue will form, and it'll just come back again. You'll just get another dented scar. So that's not an option. What you need to do is we need to get some healthy fat over the scar. Now, one thing I would say is that weight loss might help. Now, I'm not saying this patient is overweight, but I'm just saying that the fact that there is a bulge is made more obvious by the more fat there is in the abdomen, the more sort of bulging they'll have on either side of the dent. And anytime you have a dent, it'll look more bulgy than it is. But if you were to lose some weight, that would help with those bulges. It might not. It'll probably still be a puckered scar, but it would look better. And it is something that would be amenable to surgical revision, and surgical revision would involve cutting it out, keeping the dermis, keeping the layer underneath the skin, letting that drop down, and then you'll have a defect there. Oh, it's above the belly button. Oh God, I'm correct. There you go. Right, can we just forget the last? Actually, that's a lot better. Actually, that lighting's a lot better, isn't it? Right. Okay. So it's above the belly button. Okay, so I did have it upside down. That was obviously a top. I thought it was trousers at the bottom. Okay, that's awkward. So anyway, the the surgery or the process would be the same. So it would be sort of cutting out the scar, giving you a fresh scar in the same place. That's the important thing to stress. So anytime you do scar revision, you're still going to have a scar. So we're just still going to give you a fresh scar in the same place, but you just sort of just take the skin off. So leave the sort of dermis, leave the bit underneath the skin, let that dermis drop down, and then you'd have to get some of the fat from either side of the scar and then bring it over the top of that dermis to give yourself a buffer, to give yourself some healthy fatty tissue, so that there's not a line from the skin down to the abdominal wall of scar. You want to break it up by bringing some fat over the top of the scar and not having a line of scar to allow that scar to go all the way back down to the abdominal wall. Because whatever happens, once you finish the surgery, you will have more scar. You will have a line of scar, no question about it. What we've got to try and do is stop that scar from scarring back down and giving you exactly the same problem as what you've got now, because that unfortunately is a risk. Anytime you do scar revision, you're creating new scars, and perish the thought you could actually have a scar worse than the original scar, because it'd be very obvious to start off with. So that's one. It won't be more obvious because of the redness. So perish the thought it'd be worse. We wouldn't do it if we thought it was going to be worse, but that's always possible. But even if it's not worse, it could be not better, and that is the risk, that you think you've done a great job, and often it looks fine to start with, but then over time it can potentially scar down again and cause a recurrence of the puckering. So it's easier than people think it's easier than it is to revise puckered scars. They're never as easy as you think it's going to be, because you are fighting scar. We are fighting the scar all the time, and we just have to try and give you a different scar which is better than your scar. So as I say, there are things we can do to give you a better scar, or a different scar, and hopefully let's go around and right, hold that upside down. That was good, wasn't it? I see what I couldn't have. Well, I probably could have rotated it if I'd done it on the computer. So scar revision is all about giving a different scar and hoping that our scar is better than the original scar. And unfortunately, to be honest with you, we can never guarantee that. So it's always going to be. It depends on how much it bothers you. So if it doesn't bother you that much, I'm like, and maybe losing a bit of weight might help, taking some fullness on either side of the scar. I'd be like, But if it bothers you a lot, it's something that could be addressed with surgery to as I say, get some healthy tissue over the top, in between the scar and the skin and the abdominal wall, because at the moment you've got scarring all the way from the skin to the abdominal wall. There's normally fat there, and the scarring all the way down. So we have to sort of get some healthy fat on either side to try and bolster it up to stop it from scarring down. So so Kirsty says about the belly button. There you go. That's a good bit of insight. Olivia, much clearer pic. It was clearer, wasn't it, when I rotated it? Kirsten doesn't mind that. Doesn't mind that. Well, if you don't mind it, Kirsten. The other thing I'd say is for stuff like scar revision, tattoo removal, these sorts of things which are a bit subjective, it's always better to see us in person. And so for that reason, we do free consultations. So you don't have to pay for a consultation if you want to come and have us look at your scar or whatever it is in person, because it's always better to get a better handle. Because the other thing about this one, I wasn't sure about general or local anesthetic. Looking at the photo, I'm going to say general anesthetic, because if you start guddling around in the tummy, it might be a bit uncomfortable on the local. Having said that, if we see you in person, it might be possible on the local. But anyway, that's so in-person consultation is always good, because it is we can be more accurate about what can be achieved when we actually feel the tissues and see you. So Olivia says, is stretch mark revision not realistic then? No, Olivia, stretch mark revision or stretch mark treatment is not, well, I wouldn't say not realistic. It's nothing that I've got. Goodness knows I've seen people who say they've got stuff, and there's all sorts of things that people are doing for stretch marks. But I haven't seen anything that consistently is working very well personally. But I'm not an expert in this area. So if someone comes to me with stretch marks and wants the stretch marks addressed, I haven't really got anything for that. But I know there are people out there who say they have, and it's really a question of seeing them and seeing if their things are working and seem to be realistic. Kirsten says, thank you, Kirsten. And you know where we are if you need us, or me, or us, or anyone. And so I'll tell you what, that photo for me was a highlight. It was a thank you for that. Love it. And I know if this is a podcast, the photos a weak point of the podcast, but you get the impression it was a dented in scar. For podcast people, it was a dented in scar on the abdomen above the belly button. I thought it was below the belly button, so just it was above the belly button, a dented in scar. But anyway, that was fantastic. So thank you for letting us show that. I don't know why I keep on saying us. I'm trying to make it out as some kind of big thing. No, it's just me. And yeah, I hope you're liking the new angle. I have to look back at it, see if we can do this all the time, but I'm not using my mic. Mic number 1 is not working. Anyway, mixing it up, changing it up, that's how we roll. Always doing something a bit different, always on the edge, cutting edge. I'm going to go and leave now, and I suggest you do likewise. If you have any questions, you can ask me right now. Okay, so if you haven't got any questions, then I'm going to check out, and if you can always ask me on the replay or on the comments, and I'll ask them next week. Because actually, no, I say other thing. I'm not going to be here next week. It's half term, because I know Olivia wanted a Halloween special, but it's half term, so I'm away, and so I'm not going to be here next week. So please ask your questions, and we'll roll it over, and we'll have a mega one on the week after. And if you've got any photos you want me to, or not want me to, don't mind if I show, that'd be even better, but not in any way necessary. I can just describe things. And so it will be a week on Tuesday, 7 o'clock, Facebook Live. Hoping very much to see you there, and have a lovely, lovely evening. Bye for now. As he slickly ends it, slick as a slickness. There we go.